You're listening to What the Gut, a functional medicine and holistic health podcast for busy women who are ready to take charge of their health without the overwhelm. I'm Allison, your host, a double board certified family nurse practitioner specializing in functional medicine, here to help you decode the gut hormone connection and finally get the answers that you've been searching for. In this space, we're cutting through the confusion and diving deep into holistic wellness, because feeling your best is not just about another diet or quick fix. It's about understanding your body, healing from the inside out, and making sustainable changes that fit into your real, busy life. From gut health to energy struggles, hormonal imbalances to sustainable weight loss, I'm bringing you practical strategies, expert insight, and real talk that will help you thrive, not just survive. So if you're ready to finally feel good in your body again, hit that subscribe button and let's do this together. Quick reminder, this podcast is for educational and empowering purposes only, and it is not intended as medical advice. Be sure to consult with your personal healthcare provider for personal recommendations. Welcome to What the Gut, where we take control of our health one episode at a time. What to expect the day of your surgery. This is exactly what the day of surgery looks like for me. I was first case. I had to get up super early after having nothing to eat or drink before midnight. I wore a button-up long nightgown and some shorts underneath so that it would be really easy to put my clothes back on to go home. I recommend not just a t-shirt, but you want something that can button up, especially because you might be sore, or if you do have surgery on your breast, they want you to be careful with your arms. And I wore my slippers. So you want some kind of shoes that are easy to get on and off, super easy. Because my hair is very long and you have to put it like up in that bonnet whenever you go to surgery and you're laying down, and then post-op you're going to be like sitting up or laying down. I braided my hair, so I had it like in two braids so it wouldn't get all tangly. And once I actually like was coherent and felt better, I would have time to brush it, but I didn't have to worry about my hair or anything like that. No jewelry, no makeup, all that good stuff. And whenever I got there, they prepped me, went over everything with me, gave my husband my prescriptions for any kind of pain medicine I would need. I'll say too, going back a little bit, like my kids spent the night with my parents the night before. So that was really helpful because I didn't have to like worry about getting them anywhere that morning. Also, I made sure that the house was ready. So like the recliner was set up with everything ready for me to come home and sit in, and I had all my snacks ready at home, all of that stuff. So my husband didn't have to scrounge around to get it together. And I also had a notebook laid out so that we could take notes and write down when I had my medicines and things like that. So once they put me under, I don't remember anything. I had a breast lift. I had a full abdominoplasty or tummy tuck with abdominal repair. All of my abs had been separated, or diastasis recti is what happened. And that was really from pregnancies. But then I also had a thigh lift. All of that for me took about 5 hours. This was an in and out surgery, so I did not have to stay at the hospital. But once I woke up, I don't really remember a lot, but they helped me get dressed and wheeled me out to the car, and my husband took me home. I was wrapped up like everywhere. I did have to purchase my own post-op bra. So I brought that, and they like had put that on me before I woke up. They had some gauze and things in there. And then I did have an abdominal binder that they gave me. So all of that was wrapped up. And then because I had my thighs done too, they were wrapped up with like Curlex and gauze. I wasn't supposed to touch my dressings or anything. I had to see my surgeon. I think I had a follow-up the next day or maybe 2 days post-op. So everything I left alone as is. Now, I was very sore, but I tried to keep the pain medicines in my system around the clock. So I could not stand up straight because I had the tummy tuck. I literally was like at a 90-degree angle. So even getting up to go to the bathroom, anything like that, like I really had to have help. And because I had surgery on my thighs, even like squatting down to sit on the toilet was very painful. So everything was just really difficult and really hard. Let me say though that I'm so glad I knocked it all out and had it all done at the same time, but it was a lot. And even 10 years later, if I would have waited until I was like in my mid 40s to have this, just I think about, gosh, that would be really hard. Like, I think It's comparable to a C-section recovery, but you also have more things you're recovering from. But I know, like, with each of my pregnancies, recovering post-op, it's like it got harder and harder just the older I got. And I was a young mom, but I guess just thinking about how much more you bounce back and heal and recover faster, like, the younger you are. So if you're thinking about having any surgeries done, do it now. Don't wait till you're older, just because I think you heal faster and bounce back quicker, but also just knock it all out. Just do it all at once if you want to. That whole first day, I was just out of it. So I just slept a lot and took pain medicine. Now, I did have to get up and walk every few hours to help prevent blood clots. I was also sent home on a blood thinner shot, which is usually protocol to prevent any blood clots, because blood clots can be a big complication if after any abdominal surgery. Every few hours, my husband was like, let's get up, let's walk. I did have a walker that I borrowed from a family member, which was really helpful though to lean on and things like that, because I couldn't even like really stand up straight and my legs were sore and all of that. But also shifting my weight. We're going to talk more about this on another episode, but because I was like so immobile and not able to like even shift my weight, guys, we don't even think about how much we use like our ab muscles just to like toss and turn in the bed or shift our weight in the chair. When I tell you, like, I couldn't move on my own, like, I could not move on my own. So I had a draw sheet underneath me. Nurses, you know what I'm talking about. But if you're not in the medical field, a draw sheet is a sheet that's folded up, that's put under a person, either in the bed or in the chair. And if you have to move them or shift their weight, you can pull it easier instead of pulling on the person. So I did have a draw sheet down because I didn't know if anything would be bleeding or oozing. I didn't want to get it on my furniture, but I'm really glad I did that too, because that was beneficial in helping my husband shift my weight. So shifting your weight, if you're a nurse, you know this as well, but you want to shift your weight every 2 hours. If you don't do this, you can actually get pressure sores and skin breakdown. I know that sounds crazy just after 2 hours, but it's very true. And I will say too, just expect swelling afterwards. So whenever I got out of surgery and came home and stuff, I didn't really feel any different. If I felt my body, I looked down and I had some cleavage already, and I was like, okay, they're higher than they were before. That's something. But my thighs still looked huge, if not bigger. I could feel them even close to my knees rubbing against each other, just because they're still so swollen. And my stomach still felt like I felt very round and big, even though everything felt so tight. So you're going to have a ton of swelling. Drains. I had 4 drains. Thankfully, I knew what to do with drains. I knew what to expect. I emptied them myself because, bless his heart, my husband would not have known what to do if I had not been there. But with the drain, your surgeon, depending on like how they do things, will or will not use drains. From what I've read though, drains are actually really good because it helps prevent the buildup of like seromas or fluid under the skin, which you can get. Because he removed a lot of skin on my body, on my legs and my stomach, he also got down to the lymphatic system. And so the lymphatic system was irritated, inflamed, and healing. And so these drains were put in, like 1, 2, 3, 4. So I had 2 from my tummy tuck, and they came out on both sides of my hips. And we'll stand up and show you if you're watching this. They came out on both sides of my hips. And then from the thigh lift, I had 2 drains, and they came out of my groin area. They were JP drains. They look like a little bulb that's like squished, and had to empty them and record output and give that to my surgeon at the follow-up appointment. Those drains, like, I just had to clip on my clothes, and it just, you feel very fragile, and that was just a whole thing in itself. It was a little uncomfortable. Obviously, you've got to strip the drain, the tubing on there, and that was like a whole thing. With the recovery though, making sure that you're eating healthy, high quality protein is going to be really important. It's important for keeping your blood sugar balanced anyway, making sure that you're full, but also helps with wound healing. It helps make sure that your skin is healing properly, making sure that you're eating like real whole food, plenty of vegetables, things like that. You don't want to eat a bunch of sugar or junk food. You really don't want to do that post-op, because any of that inflammation can really cause issues. And if your blood sugar goes up and in your blood you've got high blood glucose, you're just not going to be healing as appropriately. And we're wanting more blood flow to get to these areas that are working on healing and nerves reconnecting and all of that. And if your blood is not full of nutrients, but more so full of sugar, that's just not going to help it. So making sure you're eating properly afterward, it is a really big thing. Making sure that you wear your like compression garments afterwards is really huge as well. Having more compression is going to prevent any kind of seroma or fluid buildup like under the skin. So that's really important. I think keeping in mind that you're going to be swollen for a long time is really important. My doctor specifically said it can take up to a year to completely heal and see like the best results from everything. Be patient with the process. Right now, I am, as I'm recording this, I'm 1 month post-op and my thighs look the exact same that they did before, except for the incision. And I know that I'm still very swollen, and I know that's part of the process. Just keeping that in mind and understanding that it's gonna get there, it's gonna happen, but you just have to be patient with it. That's really important. And also the mobility restrictions. This has been so hard for me because I'm not a sedentary person. I'm not somebody who sits around and watches TV. I actually like never sit down in my living room and watch TV except like after I've had a baby or something. And so for me, this whole recovery just really reminds me of being postpartum, but there's no baby. And the funny thing is, though, it's just been really humbling and just a good way for me to just sit and rest and be present, enjoy the Lord's presence and say, okay, slow down, let your body heal. So just finding something to do, watching TV or journaling or having your Bible, things there. Don't be on your phone the whole time. Make sure you're really taking advantage of this healing opportunity and focusing on the right things. Hydration is so important post-op, but it's going to help with your lymphatic system too. Your lymphatic system is going to be very important because that's also how you detox. So whenever you go through a surgery like this, you get so much medication pumped in you. And this was one of the reasons why I wanted to do all of my surgeries at one time. I did not want to have to repeat this whole like procedure of possibly getting an infection because of a surgery and exposed to all these different drugs and antibiotics whenever I've worked so hard on my health and my gut health and detoxing, and just to have a different surgery like every few months or a year, like, no. So I was like, let me do this all at one time. So I had a bunch of like pain meds in my system and antibiotic post-op. I will say, I was really nervous about the antibiotic because I have not had an antibiotic in years. If you have been listening for a while or know me, I'm just so in tune with my gut health and have worked so hard to get it to where it needs to be. I really don't want to take an antibiotic. But for me, pros versus cons here were very important. So taking the antibiotic, even prophylactically post-op, is whenever you have such a big surgery and are cut into in so many areas. And like for me with my thigh lift, the incision goes up to like my groin area. These are areas that like if you're sweating a lot or like even whenever you're going to the bathroom, like these areas are just like more prone to infection. So keeping them clean is important. But if any infection presented itself, like that could have been terrible. And so taking the antibiotic, I was like, let me just take it. Like I'm not going to play games. That might, if I didn't take it, I might need more surgeries or have worsening outcomes. So take the antibiotic. But also, I had a protocol in place after my surgeries to detox from everything and get all of that anesthesia and medicine, like pain pills, out of my system because I just feel weird post-op. But I'll say too, take stool softeners. Make sure you're pooping every day. Like aside from surgery, you should be pooping every single day. And I say aside from surgery, as in if I'm not even talking about surgery, like just in general, if you've been listening, you hear me talk about this. Like you need to have a bowel movement every day. But post-op, all of the anesthesia and narcotics, opioids, like whatever pain medicine they give you like that, it can make you constipated. It slows things down. If you're not hydrating, you're also not going to be going to the bathroom or eliminating as much as you should. But if you're also less mobile, like I was, and just sitting in the recliner or in the bed a lot post-op because you're resting, you're not moving your body, you're not going to be pooping regularly either. So there's so many factors against you here that could allow you to get constipated. So stool softener, it's not going to make you go to the bathroom. It's just going to soften up what you've already got. I'd say just really make sure you do that. That is really important. So all of that to say, recovery, little by little, every day I got a little better. For me, my breasts were not tender at all. I think the only soreness I ever experienced was like occasionally I felt like I need to nurse a baby. If mamas, if you know what I'm talking about, like whenever you are lactating and nursing a baby and your breasts get full and there's just like that discomfort at first, that's probably all I felt with my breasts. That was the easiest thing. My thighs, that is such a tender area. So my incision goes in the through the it's like on the inner part of my thighs and goes up into my groin. And that area is just very like delicate and tender. And just picture like somebody pinching you there. Like that hurts, right? So like that area was painful and tender. And then like my stomach, everything with that more so tight, like very tight. And occasionally I'll have like nerve pain, like pins and needles, tingling, burning, but not really like pain. But staying on top of like anti-inflammatories and pain post-op is going to be very important. It took me about a month, I will say, which today I'm like a month post-op in 3 days to stand up completely straight. So even now I can lean back a little bit, which is good, but I could not stand up completely straight for a month after this tummy tuck. Now I want to say too, my doctor specifically told me when he does any kind of surgeries, he wants it exaggerated. He exaggerates it. So he may have made my stomach tighter than the average surgeon because over time, like there's gravity, there's laxity, things are going to give. But for me to have the best results long term, like he wants it to be great, right? So like I completely appreciated that. And all that to say, that's why it took me so long to stand up straight. And you don't want to push it. You don't want to try to pull because you're going to be pulling on those incisions. But yeah, recovery has been okay in that regard. I will say that as far as exercise goes, I can do walking and I've been cleared to do like light weights. And by lightweight, 5 pounds or so. But I have not really done a lot of that yet because I'm just trying to like take it easy. But my legs, the incisions in my thighs, even sitting cross-legged, things like that are still tender. It's still like really tight. Anything that'll pull on those incisions. I would just encourage you to ask your provider post-op, like whenever it's good to move again, do exercises, things like that, because depending on what all you had, it's going to vary. And different things that I've had post-op that have been very helpful. Scar therapy. About 2 weeks post-op, my doctor suggested that I start using this silicone ointment on my scars. It's going to help with healing over time. It's going to help that scar fade and not be noticeable, even if it's in a discreet place. But also red light therapy. Red light therapy is really great. The red light I have has different settings to where it can either be like superficial or deep tissue. And I have a setting on there where I can do both. So I'd make sure I do that almost every day. But then also scar massage. The scar massage is going to help prevent any buildup and break down any of that thickening scar tissue around your scar. So I'm to the point now where my scar is like really thick around it and tight. But if I massage it like in a circular motion with that silicone gel, or even pull on it a little bit, like that is very helpful for it. It helps make it feel not so tight. But then also lymphatic massage. I went and got a lymphatic massage and it helps get rid of any of that like extra swelling or bloating that you might have after surgery, which is so common. And for me, I didn't have a ton, I felt like I don't have a ton of extra swelling except like in my lower pelvic region. And it was like that was bigger than like my stomach. And so it was very odd. But when I went to have this lymphatic massage, like it felt so good. All of that went away. And it's actually recommended to do this like maybe twice a week for a while after surgery. But if you're not going to get this professionally done, at least sit in the bed afterward and sit in the bed at the end of the day and learn some different lymphatic massage techniques to help get rid of some of that extra fluid on you. I hope that this was very helpful for you. I hope that if you're going to have a surgery, that you take some of these things into consideration, that they were things that were beneficial for you to learn. And I hope you enjoyed this episode. That's a wrap on today's episode of What the Gut. I'm so grateful that you're here, and I hope you're walking away with insights that bring you closer to feeling your absolute best. If you loved this episode, it would mean the world to me if you would take a moment to leave a review. It helps more people like you find this podcast and get the answers that they need. And don't forget to hit that subscribe so that you never miss a new episode. Let's keep the conversation going over on Instagram. Find me at Allison Gets Well for daily gut health tips, behind the scenes, and more ways to support your wellness journey. I would also love to hear what topics you want covered in future episodes. If you have a burning question or a guest that you'd love to hear from, shoot me an email at hello@allisongetswell.com. If you're ready for real personalized support on your health journey, until next time, stay curious, nourish your body, and take care of your gut. Catch you soon.